on then to another issue, and that is in regards to Papua New Guinea and the border. Now, that you've said this week that the PNG Queensland border is unsecure,
That's right.
and you've called on the federal government to rethink asylum seeker plans. You're the health minister. Is that really your role?
It certainly is when Queensland is under a very, very serious disease risk and disease threat because of the very porous PNG Australian border. This particular border is as porous as a spaghetti colander. It is as porous as a spaghetti colander. We have so many people pouring across that border. There is a free arrangement between PNG and Australia, and that is that people can go back and forth.
So they're
as
allowed,
a whim.
it's allowed
they're
to
able
be
to
porous.
do that.
It's deliberately porous.
And that's right. But the problem we actually have as Queensland Health, not only this government, but the previous government, is that we are losing about $10 million a year in treating PNG patients for quite serious illnesses, such as tuberculosis.
Drug-resistant tuberculosis.
Drug-resistant tuberculosis. And indeed, only 2 months ago, a person was brought into one of our facilities, indeed a Syrian national who had found his way from the Middle East to Indonesia, to PNG, entered into the northern waters of Australia and island hopped his way down until he was found. And the only reason we found out was because he was brought to our facility with suspected tuberculosis. Now, what Kevin Rudd's plan does is basically deliver masses of asylum seekers to PNG and basically puts them on our doorstep, hop, skip and a jump. Now, the previous government
But if it was so easy then for asylum seekers to use it as a stepping stone, why aren't they doing it now rather than dying in boats off Western Australia?
Well, I think that a lot of people haven't really woken up to it, and the mere fact that only in the last 6 to 8 weeks we've had a Syrian national who's come down through there, been apprehended, presented to our facility, and the information I have in recent months, up to 6 other people without papers who weren't PNG citizens, again presenting at our facilities. These are only the ones that we actually know about. The reality is it's as simple as getting into PNG, a canoe ride to Saibai Island, which is only a few kilometres, and then 2 plane tickets and a taxi fare and in the western suburbs of Sydney. But the reality here is that we have serious concerns because we've now got real disease risks. The same thing as Peter Beattie raised a number of years ago. They've never been addressed. The previous government actually wrote to Doha and the federal government some 2 years ago asking them to do something about securing the border. That didn't happen.
So what is it that you want? Do you want more money to treat those Papua New Guinean people that need health care coming into Australia for desperate help? Or is it that you want asylum seeker change policy?
Well, we need 2 things. One is that we need the appropriate amount of reimbursement for the 1,100 odd people that we treat from PNG each year. 200 of those hospitalised with some of them with quite serious disease.
Yes,
the other one is
a
recognition that we have a serious problem with regards to the porous nature of that border, and anyone can just step across it, and it needs to be addressed, particularly in light of the most recent changes to asylum seeker policy.
All right. Well, Queensland Health Minister Lawrence Springborg, thanks very much for speaking to us tonight.
You're more than welcome.